POTS. No, not the eccentric character from Chitty Chitty Bang Bang. No, postural orthostatic tachycardic syndrome. Oof. Right, postural is to do with whether you're changing position, lying down, standing up, sitting down, etc. Orthostatic is to do with the pressure of orthostasis is fluid pressure. Tachycardic, fast heart rhythm, or very fluctuating heart rhythm, and syndrome just as a name for here's a thing we don't really understand very well. This is really a label that people give in the medical world to a gathering of symptoms presenting in a particular way, but it is hugely linked to EDS, Ehlers-Danlos syndrome, which is also another condition which has started presenting itself as yet another label. I get sort of quite passionate about these patients where, I've been diagnosed with POTS now and I've got EDS, and I'm going, of course you have, yes. And you've probably got this as well. Oh my goodness, yes I do. How did you know that? Because they always go together. POTS is when we fail to get the appropriate signaling to our heart to affect the contraction rate and strength. So the regulation of the heart is under the control of the SA node and the AV node. And they're kind of like the heart's natural pacemaker. Yeah, they govern that background, quiet control of the heart going on whether we're sleeping, lying down, don't need to change it at all. It's just that background rhythm, and that is a self-perpetuating rhythm within the nervous system of the heart itself. But the autonomic nervous system, our lovely friend, the autonomic nervous system, has an overriding influence on that. And it is that messaging system which will cause it to increase or decrease. If we decide we're going to go for a run and we start to get messages that saying, all right, hang on a minute, these legs are working, there'll be communication going through saying, well, look, divert the blood away from here. We need the heart to pump more because these muscles apparently need more oxygen. We need this to pump through the lungs so that we can get rid of the excess CO2, we can get the oxygen coming into the system, we can start to prepare to do the activity we need to do. Or we are now lying down, we will register the pressure changes through baroreceptors within our circulatory system and say, well, hang on a minute, the legs are higher now, so actually the pressure's changed in the legs, but actually we've got a higher venous return, so that's changing the pressures coming back into the chambers of the heart, and so we're going to change how strongly they contract. All of this is happening all the time. Yeah, startle responses, emotional responses, heart rates can go up or down or beat harder if we're moved emotionally watching, our children perform on stage or something like that. All the time, autonomic nervous system is having an overarching response to this. So, back to it again, a dysregulated autonomic nervous system for whatever reasons, and that can lead us to look at trauma, emotional responses, etc., will be at the root of POTS. Not many people are looking at it. Very often the biochemical model will be, let's try to actually regulate that through using some kind of beta blocker or to stop the spikes or smooth out the highs and lows. Really, all the beta blockers are doing is actually just stopping high spikes in the sympathetic nervous system and fluctuations in the autonomic nervous system. It's a biochemical way of falsely ring fencing wild fluctuations and vacillations in the nervous system supplied to the heart. So how do we treat POTS? Get to the root of the problem, get to why the nervous system's been dysregulated. And I just think if we were to look at how many people have EDS, how many people have POTS, how many people have mast cell syndrome, how many people have, fibromyalgia, chronic pain, disturbance, and we go, look, they're either jolly unlucky or there's a connection here. And when, if you're working with POTS out there and you stop thinking that you're just dealing with POTS and you start looking at the whole presentation and go, what is it? What possibilities are there out there that might influence all of these presentations? Yeah, the mast cell activity, the POTS, the IBS, their brain fog, their migraines. And if you can find a system that, if dysregulated, would cause all of those problems. It seems like that's a pretty sensible place to start treating it. Most people aren't doing that, certainly in the medical world, but that's what I do. I work to that psychological and neurological control and regulation, and how that will then influence beyond the POTS into these other autoimmune inflammatory conditions that so often go with it.
Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.